Welcome to Life Care for You. In today's video, we'll be discussing diabetes, a chronic condition that affects how your body turns food into energy. Diabetes occurs when your blood glucose, or blood sugar, levels are too high. It's a widespread condition that affects millions of people globally, and it can lead to serious health complications if left unmanaged. In this video, we will define diabetes, explore the symptoms, causes, and treatment options, and offer some important precautions to help manage the condition effectively. What is diabetes? Diabetes is a metabolic disorder that results in high blood sugar levels over an extended period. Glucose, which comes from the food we eat, is our body's main source of energy. Insulin, a hormone produced by the pancreas, helps glucose get into our cells to be used for energy. In people with diabetes, the body either doesn't produce enough insulin or doesn't use it as effectively as it should. As a result, too much glucose remains in the blood, leading to a range of health issues over time. There are three main types of diabetes. Type 1 diabetes, an autoimmune condition where the immune system attacks the insulin-producing cells in the pancreas. This type of diabetes is usually diagnosed in children and young adults, and people with type 1 diabetes must take insulin every day to survive. Type 2 diabetes, the most common form of diabetes, where the body becomes resistant to insulin or doesn't make enough insulin. This type often develops in adults, but is increasingly being diagnosed in younger individuals due to rising obesity rates. Gestational diabetes. This type of diabetes occurs during pregnancy and typically goes away after the baby is born. However, it increases the mother's risk of developing type 2 diabetes later in life. Symptoms of diabetes. Diabetes symptoms can vary depending on how high your blood sugar levels are. Some people, especially those with type 2 diabetes, may have symptoms that are so mild they go unnoticed. However, common symptoms include increased thirst and urination. Excess sugar in the blood forces the kidneys to work harder to filter and absorb it, leading to frequent urination. This can cause dehydration, making you feel constantly thirsty. Fatigue. When your cells don't get enough glucose, your body becomes tired, leading to fatigue and a lack of energy. Unexplained weight loss. Despite eating more, people with diabetes may lose weight because the body isn't able to absorb and use glucose properly. Blurred vision. High blood sugar levels can pull fluid from the lenses of your eyes, affecting your ability to focus. Slow healing wounds. Cuts and sores may take longer to heal due to high blood sugar, which can impair blood flow and damage nerves. Frequent infections. Diabetes can weaken the immune system, making you more susceptible to infections, particularly in the skin, gums, and urinary tract. Tingling or numbness in hands and feet. This can be a sign of nerve damage caused by high blood sugar levels over time, a condition known as diabetic neuropathy. Causes of diabetes. The causes of diabetes vary depending on the type. Type 1 diabetes. The exact cause of type 1 diabetes is unknown, but it is believed to be an autoimmune disorder. The immune system mistakenly attacks and destroys insulin-producing cells in the pancreas. Genetics and environmental factors, such as viruses, may play a role. Type 2 diabetes. Type 2 diabetes is primarily linked to lifestyle factors, including poor diet, lack of physical activity, and obesity. Genetics also play a role, as family history can increase your risk of developing the condition. In this form of diabetes, the body becomes resistant to insulin, meaning the cells don't respond to insulin as they should. Gestational diabetes. Hormonal changes during pregnancy can make the body less sensitive to insulin, leading to gestational diabetes. Factors such as being overweight, a family history of diabetes, or having had gestational diabetes in a previous pregnancy can increase the risk. Complications of diabetes. If left untreated, diabetes can lead to serious complications. Heart disease and stroke. High blood sugar levels can damage blood vessels, increasing the risk of heart disease and stroke. Kidney damage. Diabetes can damage the kidney's filtering system, leading to kidney failure over time. Nerve damage. High blood sugar can cause nerve damage, particularly in the legs, leading to pain, tingling, or numbness. Eye damage. Diabetes can damage the blood vessels in the retina, leading to blindness if not treated. Foot problems. Poor circulation and nerve damage can lead to severe foot infections, sometimes resulting in amputation. Treatment of diabetes. Managing diabetes involves a combination of lifestyle changes, monitoring, and medication. Here are the key treatment approaches. Medications. People with type 1 diabetes require insulin therapy to regulate their blood sugar levels. Insulin can be administered via injections or an insulin pump. For those with type 2 diabetes, oral medications such as metformin or insulin may be prescribed to help control blood sugar levels. Healthy eating. A balanced diet that includes whole grains, fruits, vegetables, lean protein, and healthy fats is crucial for managing diabetes. Monitoring carbohydrate intake is especially important, as carbohydrates have a direct impact on blood sugar levels. It's also advisable to limit sugary foods and drinks. Physical activity. Regular exercise helps control blood sugar levels, improves insulin sensitivity, and supports overall health. Activities like walking, swimming, or cycling are beneficial, and aiming for at least 30 minutes of moderate exercise most days is recommended. Monitoring blood sugar. Keeping track of your blood sugar levels is essential for managing diabetes. Regular monitoring helps you understand how your body responds to different foods, activities, and medications, allowing you to make necessary adjustments. Weight management. Maintaining a healthy weight is crucial for preventing and managing type 2 diabetes. Even a small amount of weight loss can improve insulin sensitivity and help control blood sugar levels. Precautions in lifestyle management. To effectively manage diabetes, certain lifestyle adjustments are necessary. Routine checkups. Regular visits to your healthcare provider help monitor your condition and prevent complications. Eye exams, foot care, and screenings for kidney function are especially important for people with diabetes. Manage stress. Stress can affect blood sugar levels, so finding ways to manage stress through relaxation techniques, mindfulness, or hobbies can be beneficial. Quit smoking. Smoking increases the risk of diabetes complications, including heart disease, stroke, and nerve damage. Quitting smoking improves overall health and helps manage diabetes more effectively. Stay hydrated. Drinking plenty of water can help control blood sugar levels and prevent dehydration, which is especially important for people with diabetes. Conclusion. Diabetes is a chronic condition that requires lifelong management, but with the right treatment and lifestyle changes, it can be effectively controlled. By staying informed, monitoring your health, and working closely with healthcare providers, you can reduce the risk of complications and live a healthy, active life. This video is for educational purposes only and is not a substitute for professional medical advice. If you or someone you know is living with diabetes or experiencing symptoms, consult a healthcare provider for proper diagnosis and treatment. Thank you for watching Life Care for You, and stay tuned for more informative health-related content.